anti-neoplastic drugs. As you probably are aware by now, cancer is the number two leading cause of death in the United States. So the goal of this lecture is to generally briefly discuss about cancer and then understand the main terms in terms of cancer treatment, but really focus on chemotherapy. So as far as cancer, we lose about 600,000 people to cancer every year, and statistics show that about from every 100,000 people, there's probably 183 people, like 10%. I think there's 10% diagnosis of cancer. So you don't have to know the statistics of the cancer and rates and population and all that, but you do have to know what is cancer. So cancer is actually nothing but uncontrolled rapid cellular growth. So if we want to look at the sheet that you have so far, in your from your form booklet, you'll see that it can be spread to other organs, and that's when we call it metastasis, right? Stage 4 cancer. And once it starts spreading to the different organs, it's really very difficult to control, and it can grow and invade the adjacent tissues and then break away from the original tumor, travel through the blood, and thereby spread to the distant sites. So in general, if we want to define cancer, it's uncontrolled and rapid cellular growth. So cancer can affect pretty much any organ in the body, from the eyes to even heart cells sometimes, to the skin, to the muscles, to the blood, to the the lymphatic system, etc. And as far as the risk factors, age plays an important role. After 65, there's a high risk. Genetic factors play an important role. Ethnicity, like for some cancers, it's more common in certain populations versus the others. Occupational and environmental carcinogens, you probably hear a lot in the news sometimes, right? Like the weed killer that was out there last year. And then there are also radiation and immunological factors that might play in a role. So there are various, causes for cancer. But in general, like, how does this happen? So if you remember from your biology, cell growth cycle consists of multiple phases, right? In general, we usually talk about the mitosis, meiosis, but even before mitosis happens, there's a G phase, and then the S phase, and then comes the M phase, right? So if we look at before the cell reproduces, that is, one cell becomes two, what is happening is at the inside the nuclear membrane, the DNA can replicate. The nuclear membrane splits. So there's so many changes that happen inside the cell even before this happens. So at the resting phase, there's a synthesis phase. So you don't need to know all these phases, but just to have an idea of where we can actually target treatment through chemo is important to know. So in general, cancer can be treated by surgery, radiation, chemotherapy, either or maybe someone can need all the three, like some type of cancers, depending on the stage and the grade, we call it, right? And then depending on what the patho result shows, right? So the biopsy is the gold standard for cancer diagnosis. Without doing a biopsy, you cannot confirm cancer. For cancers like multiple myeloma, where there's cancer in the bone marrow or in this, like inside the marrow, it's really important to even do a biopsy in the bone marrow that's done through a lumbar puncture, from the lower back. So for this handout, we're going to really only look at chemo drugs, right? We can also call chemotherapy as cytotoxic drugs or anti-cancer drugs or cancer drugs, right? So in general, when you think of anti-neoplastic or chemo drugs, they're pretty much classified into two types: the cell-specific or the cell non-specific. Okay, cell cycle specific or cell cycle non-specific, meaning when it's cell cycle specific, it targets particularly the G or the S or the EM phase, versus when it's non-specific, it targets pretty much any phase of the cell. And by now you already know those cell cycle non-specific might be more potent because it's targeting any cycle. So you want aggressive cancers to be treated by the non-specific ones. So as far as in terms of chemotherapy, generally chemotherapy drugs have a narrow therapeutic index. and usually more than one type of drug is needed for treating a particular type of cancer. So, for instance, breast cancer cannot be treated just with one drug. It needs a combination of few drugs, again, depending on the grade and the stage, right? Um, a patient with grade 3, stage 3 might get combination of chemo drugs versus a person with stage 1, grade 1 might not even receive chemo. Maybe it's treated only with radiation. So there's a lot of differences, right? So drug can also form, we can also have resistance to certain drugs. For example, after receiving oral chemo or small doses of IV chemo, one can become resistant and then the cells can still grow, right? And of course, all these chemo drugs have severe side effects, if not lethals, because the drug is supposed to help and not harm, but these adverse effects are pretty bad. You probably heard about it, right? But they can also have dose limiting adverse effects depending on the age. And in fact, they not only kill the cancer cells, but they also kill the normal healthy human cells. That leaves us to think, how to balance these side effects, right? Of course, you probably heard from your family or distant friends, or maybe you personally had a very close episode with cancer in your family, that there will be hair loss, right? What happens is there's hair loss when patients receive chemo, right? And then most of the organs, like most of the tissues that are affected, are the ones that can replenish faster, meaning like hair cells, like GI, like in the GI mucosa, and the bone marrow cells. So those can be really impacted. Hair loss is very common, nausea, vomiting, diarrhea, and then bone marrow, meaning like patients might have low white blood cells, low hemoglobin, low platelets, and sometimes these might prevent them from receiving, the next dose of chemo that's scheduled, which causes a lot of anxiety, right? So here are some terms like alopecia, emetic potential, meaning like some chemo have more potential for causing emesis, right? Meaning like nausea and vomiting. So let's move on to talk about the class of medication. So the very first class of drugs, those are um, the anti-neoplastic class, or the CCS, the cells equal specific, right? So those are the anti-metabolites. So what happened was historically methotrexate was used to treat cancer. Of course, it is an abortive medication, right? So it was accidentally found when patients had cancer. They thought that if we give them excess folic acid, then cancer might not grow. So from that is when they identified that methotrexate, which is a folic acid antagonist that acts on the S phase specifically on the cell cycle, can help with preventing progression of cancer, right? Because folic acid is really important for DNA synthesis, when you kind of prevent synthesis of that DNA, what can happen is cancer cells cannot grow. So that's how it works. So methotrexate has has a lot of side effects, liver toxicities. Of course, infertility can be caused, or loss of baby in children, in mothers with pregnancy. Neurodeficits too can occur. So this is the first class of antibiotic. The other class of antibiotic are the purine and the pyrimidine antagonists. You probably heard these terms when you did talk about when you did your biology classes a few years ago, right? So what these drugs do is they actually interrupt both the DNA and the RNA synthesis through the purine and the pyrimidine nucleotide base. If you think about the nucleotides and the DNA, and if you remember the cytosine, adenine, guanine, right, thymine, those are the several proteins available in the DNA too, in the strand, right, the double helix. But predominantly, the purine and the pyrimidine are targeted to interfere with your DNA and RNA synthesis. So example of a pyrimidine would be fluorouracil. So you need to know fluorouracil in this page, and you need to know methotrexate. So if you look at this antimetabolite class, I really want you to know that this is usually used for treating solid or circulating tumors, but one important side effect is tumor lysis syndrome. So what happens is when we suddenly inject someone with these high toxic, high potential, cell toxic, they interfere with the cell growth, right? What happens is the cell kind of disintegrates. It kind of, the cell is kind of destroyed. So when that happens, the potassium in the cells, the phosphate in the cells, and there's excess, formation of urea, and that leads to, uric acid. So the kidney kind of gets overloaded, and this is called tumor lysis syndrome. So when a patient is given one of these drugs like methotrexate or fluorouracil or the other drugs, which we've listed here, what can happen is they can have sudden, like kidney failure type of symptom, like burning urination, like anxiety, irritabilities, because there's sudden cell death and at a rapid phase, right? So that makes it really hard for treatment. When tumor lysis syndrome does happen, there is treatment available. Patients can be given allopurinol, which is a gout medication. So the next class of drug is cytotoxic during any cell stage, meaning the cell cycle non-specific drugs. So at any stage they could, destroy. This is really important for aggressive types of cancers. And obviously they have more side effects. So there are this class called the alkylating agents. And in that alkylating, it's the nitrogen mustards. If you remember nitro, right? We talked about it before, right? They're like almost like the nitrogen bombs, right? They suddenly like explode, if you want to remember that way. So some of the really potent and very effective drugs are cisplatin. If you hear this word cisplatin, it's pretty much used for many cancers, like prostate, leukemia, Hodgkin's, and non-Hodgkin's. So what they do is they alter the chemical structure of the DNA of the cell itself, right? So that's how they work, and they prevent cancer cell from multiplying. I really want you to know cisplatin and cyclophosphamide, okay? So cyclophosphamide is also an alkylating agent. So what they're used for is to treat breast cancer, and things like bone, lymph, blood, and solid tumors, right? And also Hodgkin's and non-Hodgkin's. But I'm not going to test you on which type of cancer they're going to be used for, but at least know that they're alkylating agents and they're CCNS drugs, and where they work, their name itself, right? And then specifically knowing that cyclophosphamide can cause nausea, vomiting, myelosuppression, alopecia, nephrotoxicity, peripheral neuropathy, and tissue damage. So this is very important. If you want to kind of try to remember your gentamicin from your previous class, that might be useful, I think. But you can add on other things like alopecia, because unlike in any other drug, loss of hair is pretty, it's very sudden, right? So with nausea, vomiting, there's severe of these symptoms that patients need to be pre-medicated, right? And especially with the veins, there can be thrombophlebitis or extravasation, meaning the fluid kind of enters outside the cell, and they can cause tissue get damage. So it becomes really important to have this patient have a port, meaning instead of using an IV for drugs like the cisplatin and cyclophosphamide, patients might have a port in their upper chest, close to the clavicle, right below the clavicle. So again, remember the side effects, okay? The next thing is to learn about cytotoxics, antibiotics, right? See, antibiotics can also be used here because what they do is they are active in all phases. Remember from before when we learned about some antibiotics, they can also interfere with nucleic acid protein, right, synthesis. So oncologists, scientists have, found these drugs like bleomycin, daunorubicin, or doxorubicin, right? So the rubicin and the mycins, right? When you see, it's similar to the gentamicins, right? And the garamycin. So if you remember the rubicin, and mycin suffix, it should be easy. I expect you to know at least two of this. One is bleomycin and doxorubicin, especially in terms of the side effects and what class they belong to, right? So if you think of bleomycin, it's very toxic to the lungs, okay? And if you think of doxorubicin, it's very toxic to the heart. So it can cause acute heart failure. Acute heart failure that's especially the ventricular failure, right? But in addition to these two, specific to these two drugs, you should know that alopecia, hair loss, nausea, vomiting, GI, and myelosuppression is common for all chemo drugs, especially, the more non-specific they are, the more broader, meaning they have more toxicities, and it's important to control that. Because monitor that. It's hard to control them, but monitor them before giving the chemo. Because let's say a patient comes in and they're severely myelosuppressed and their platelets are below, like, normal is 150 to 400, right? Let's say a platelet number is like 70 and their hemoglobin normal is like 12 or 13 depending on male or female, and their number is 6, right? So they need to receive blood before they get the chemo. Another thing is when WBC cells go low, they could end up with a fever, right? If they have a temperature of above 100, can we give the chemo, right? So all these makes these patients high risk for infection. So when immunosuppression is caused by bone marrow, suppression because of the chemo, you probably, if you've been to a cancer clinic or when patients receive chemo, we need to make sure that we maintain hand hygiene and not make them infected, because they have to be on neutropenic precaution, meaning they should avoid certain food that are live, that contain a lot of live bacteria, or foods that are not cooked well. And they need to like stay away from plants, or like things that might actually cause them an infection, right? Like some live plants, not all plants, but to keep it away from them. So when, especially during the phase that they receive chemo. So, with that being said, I think there's going to be a lot of questions for you from the nursing implications and assessment and interventions, because when you think of chemo, it's really important from a nursing standpoint of view to be aware of any particular, side effects, and to teaching what to do, right? So, like I had mentioned before, just like the amphotericin we talked about, it's important to pre-medicate, right? And the same thing for when patients receive blood. When we suspect or when they have mild itching, or even when they start to have some allergic response, we try to pre-medicate with antihistamines like Benadryl, or in other words, we call them diphenhydramine, right? And then we can make sure that we keep epinephrine handy, because these chemo drugs can have some severe anaphylactic reaction in some people. And it's important to give them an anti-inflammatory drug. Mostly corticosteroids are given, and an antiemetic. The flare-up of your the chemo trigger zone is so huge that sometimes Zofran is not enough. So it's really important to make sure the immune system does not react to these toxic, because that's what the body does, right? When it sees there's a foreign body and there's danger, it will react to it. So it's important to monitor those, right? It's also important to watch their blood counts before they receive it, and teach them about neutropenic precautions. And it's also important to know, like the effect of allopurinol and hyperuricemia, and monitor for emergencies. For example, I talked about bleomycin as being causing pulmonary toxicity. I mentioned about doxorubicin causing cardiac toxicity, right? And some of them, can really cause some, bleed in the GI, or renal, due to the, or even like with the liver, right? So it's important to monitor them, especially the older the patients are, the risk is higher. And another important thing is to know that they might get mouth sores, like canker sores or ulcerations in the mouth, because of damage to the oral mucosa and the GI mucosa. And then patients might not be able to eat; they might lose weight, right? So women of childbearing age, usually they harvest the eggs if they receive very, like cytotoxic drugs to harvest the eggs, and also they might need to have a different type of contraception. I think more than that, there's such a huge, impact on the body with this chemo. Patients sometimes the fear of death is very huge, right? The emotional support that's needed here it cannot be underestimated. And many times, I think in our healthcare system, where we're already, short of, in shortage of the time that we can have with patients, there's always a challenge to manage the emotional, the psychosocial element. Um, so it's also important to monitor for, other things, for example, the hair loss, their body image issues. And I think many things are repeated here. But in general, overall, I think if you kind of know what I just mentioned to you in terms of the GI, the hair loss, and bone marrow suppression, and the fatigue that it can cause, and what to monitor before administering chemo, these are just the basics. So I hope this was useful. So please email me if you